upcoming immigrant health program. Welcome to our second Apple Health Expansion webinar, where we will be discussing the upcoming immigrant health program. My name is Sarah Tunnell, she, her pronouns, and I am the Senior Project Manager for the Apple Health Expansion. This webinar is being recorded, and by staying in this webinar, you consent to being recorded today. This Zoom event is in webinar mode. Attendees will not have microphone or camera access during this online event. Therefore, attendees' voices, likeness, and/or images will not be captured. Special thanks this afternoon to Shelley Hansen for ASL interpretation. Closed captions are available in English and Spanish, and we will drop those throughout in the chat several times this afternoon. You may submit questions throughout the presentation using the Q&A feature at the bottom. We will have a question and answer period towards the end of the presentation this afternoon. All web pages and additional resources will be shared at the end of the slide deck. Your presenters this afternoon are Becky Carroll from the Healthcare Authority and Joan Altman and Jenny Arredondo from the Health Benefits Exchange. Becky's going to kick us off by going over some background information. So next slide, please.
Thanks, Sarah, and thank you all for joining this afternoon. Really do appreciate you taking time out of your busy day to hear more about Apple Health Expansion and other immigrant healthcare coverage options here in the state of Washington. We want to move to the next slide. We are here today with our colleagues at the Health Benefit Exchange. As Sarah noted before, my name is Becky Carroll. I serve here at the Healthcare Authority as the Deputy Division Director for Medicaid programs. As part of that job, I have the privilege of leading a group to implement Apple Health Expansion. I'm joined this afternoon by two other panelists, Jenny Arredondo and Joan Altman, both of Health Benefit with the Health Benefit Exchange. And as we move to their portion of today's presentation, where they will cover a qualified health and dental plan expansion at the Health Benefit Exchange, they will introduce themselves. So let's start talking a little bit about the background here. If we can move to the next slide. We are talking about individuals today who are uninsured and undocumented in the state of Washington, who lack proper immigration status, or the right immigration status rather, to take advantage of Apple Health or Medicaid in its in a form that we're all used to today, or purchase previous to open enrollment qualified health plans from the Health Benefit Exchange. So what we know about individuals here in the state of Washington is that about 25% of the 410,000 individuals who are uninsured are in this population. So they are undocumented in the state of Washington. As we look forward to the next slide, we'll note that the vast majority of those individuals are also at 138% of the federal poverty level. My apologies, the slide was a little slow. And so that's represented here on this pie chart. We move forward to the next slide. What we know is that there are a lot of access challenges. The top three are affordability, of course, of healthcare coverage. The second one is really a mistrust of government and government websites, which we can all agree and appreciate. And then also really health education and language access. So what does healthcare look like? How do I navigate the healthcare system? And how do I do that in a way that is culturally appropriate for me? Or how do I really understand if everything is in English and not in my preferred language? So as we move forward to the next slide, we're really going to start thinking through what we do today. So when we say the word Apple Health, we're talking about Medicaid programs. And that is a large suite or umbrella of programs that include both federally funded and state funded, so joint federal and state programs, and then also some generally funded state programs. So there isn't necessarily a federal financial component to some of these programs. In that suite of Apple Health Medicaid programs, today we have 5 programs that provide services to individuals, to immigrant populations. The first one is medical care services. Then we have emergency medical care, Apple Health for pregnant individuals, after pregnancy care, and Apple Health for kids. So of these programs, medical care services, Apple Health for pregnant individuals, after pregnancy care, and Apple Health for kids are full scope options, meaning that they cover all your physical health needs under those programs. The emergency medical program is an exception here. It is a program designed to help individuals who are presenting in an emergent situation, usually in an emergency room or hospital. It also does cover some cancer care services, some dialysis care, and some transplant, post-transplant services as well are included in that suite. As we move to the next slide, this graph, I think, really provides a good overview of the current suite of programs, and then the different, as you move across the top there, the different types of immigration statuses and whether individuals who fall into those categories would be eligible for one or more of these programs. So this gives you a good idea of what Apple Health provides today for the immigrant population. We could go to the next slide. When we think about Apple Health expansion, it is a new step, a new investment that our legislature has made in providing coverage for the immigrant population here in the state of Washington. So you might wonder, what happens to these other programs that I just covered? So individuals who are enrolled in medical care services, Apple Health for pregnant individuals, after pregnancy coverage, and Apple Health for kids will remain in those, like I noted, full scope programs, right? So these programs are here, they're stable, there are individuals enrolled in them, and they won't see a change, an immediate change in any of those programs. As individuals age out of pregnancy coverage or Apple Health for kids, we will redetermine their eligibility and enroll them in another program if one is accessible to them. If they meet the requirements, the eligibility requirements for Apple Health expansion, and there is space in that program, we will move them over to Apple Health expansion. We could go to the next slide. So really, we're talking about today 2 coverage expansions. One that it happens in the Apple Health and a family, that Apple Health umbrella of programs, Apple Health expansion. That coverage will begin on July 1st. So we'll be diving deep into that work here over the next couple of slides. The second piece that we're going to talk about today are the qualified health and dental plan expansions that happened late last year during open enrollment, November 1st, 2023. And so our health benefit exchange partners will talk about that and what that option looks like and how that expansion has worked so far. So if we could move to the next slide. Let's talk a little bit more about Apple Health expansion. So this new program that launches on July 1st, what does that look like? If we could move to the next slide. Great. Here's a little bit of background about this particular Apple Health program. In 2022, the legislature asked the Healthcare Authority to start to think about what a Medicaid lookalike program would be for the immigrant population. And so we did do a lot of work in that area and shared many of our findings with the legislature. In 2023, we received specific direction to develop a program that provided equivalent Medicaid healthcare coverage to uninsured adults who are ineligible for other federal assistance. This direction or proviso asked the Healthcare Authority to have this new program implemented no later than July 1st of 2024. As I noted before, in 22, Healthcare Authority did do a lot of work around what this program might cost and shared those findings with the legislature. The legislature did allocate funds in 2023, but we are recognizing that that is not enough money to cover the entire population who would be eligible for Apple Health expansion. So as we think about Apple Health expansion, you'll often hear me say that it will be a capped enrollment program, meaning there are a limited number of slots available as we move forward. So if we could go to the next slide. There are a couple of key program goals here. First, we want to create a program that is much like what we offer today for Apple Health Medicaid, and specifically our integrated managed care program. And I'll dive into that here in just a moment. And we want to provide coverage to as many individuals as possible. So those are two main goals of the work that we're doing today. If we can move to the next slide. This one will talk a little bit about what we mean by integrated managed care. So in the state of Washington, we deliver Medicaid in two different ways. One way, the Healthcare Authority directly pays a provider for services given to a Medicaid enrollee. That is called Apple Health without a managed care organization or fee-for-service. Integrated managed care or managed care means that the Healthcare Authority has contracted with a managed care organization to provide healthcare services to a group of enrollees. So enrollees who've either been selected or have enrolled themselves into a managed care plan. It's a contracted arrangement between the Healthcare Authority and that managed care organization. The MCO helps to coordinate care for those individuals and pays for their the services that they receive in a provider's office. The Healthcare Authority, in turn, gives them a monthly fee or per member per month capitation payment. So that explains managed care, right? What does integrated mean? Integrated managed care is a program that meets both physical and behavioral health needs of its clients. So it is sort of full, it's full body care, right? Both behavioral health and physical health. One of the main reasons that the legislature asked us to provide a mirrored integrated managed care program is that of the 2.1 million Washingtonians who are enrolled in Apple Health today, about 85% of them are enrolled in managed care. So if we move forward to the next slide, let's talk a little bit about what will be covered in Apple Health expansion. You heard me note both physical health and behavioral health will be administered by a managed care organization. You will also receive dental services in this program. In addition, non-emergency medical transportation, which provides transportation for individuals to and from a medical provider's office for services, and interpreter services, so translation services, will be available to Apple Health expansion enrollees. This new program will also cover a full pharmacy benefit. This is a little bit different than what you'd see today in Apple Health integrated managed care. For Apple Health expansion, we are using a different pharmacy formulary, so different sort of list of drugs, if you will. It is very similar to what we offer to our public employees. So for instance, me, and what I receive as a healthcare pharmacy benefit through my employee-sponsored, my Washington State employee-sponsored healthcare coverage. The main reason that we're doing this is to ensure that we make this program as lean as possible, and B, that we are able to still draw rebates on drugs. In the Medicaid program, the federal Medicaid program, we have a pharmacy list, drug list, right, that allows us to draw down federally negotiated rebates. On the state level, since Apple Health expansion is a state-funded program, we aren't able to take advantage of those federal rebates. So we're looking for the best possible deal. One thing I could say here is that we are substantially equivalent. So the preferred drug list that you would have in Apple Health Expansion is substantially equivalent to the one that you would experience in Apple Health Integrated Managed Care today. The difference may be a name brand over a generic. If we move to the next slide, we talk a little bit about who's eligible for this program. So this program is designed for individuals who are 19 years of age or over. They have accountable income of under 138% of federal poverty level. They do not qualify for other Apple Health programs based on their immigration status. They are not pregnant or did not have a pregnancy end in the last 12 months. And they are not eligible for federal advanced premium tax credit through the individual market or federally funded medical assistance programs. So a couple key things here. This program is designed for adults 19 and over. As I noted before in a previous slide, we have Apple Health for Kids for people under the age of 18. And we also have Apple Health for pregnant individuals and Apple Health post-pregnancy coverages. And that's why those who are pregnant and who are whose pregnancy ended in the last 12 months, they would be on those two programs and not in Apple Health Expansion. So if we move forward to the next slide, I wanted to kind of give an idea of what 138% of the federal poverty level means. So what is the most that you can make to qualify? You'll see here in the bold green, a household size, and you can go from left to right there, from a single person to a 7-person household. And right below that, see what the monthly income limit would be to be eligible for Apple Health Expansion. Just a quick note here, these income standards listed in the example are subject to change annually every April. So this will be updated between now and the implementation date. And we will provide updated graphs both on our website and in other outreach materials. I want to move forward to the next slide. What documents do you need? So as you think about enrolling in Apple Health Expansion, here's some information that you want to think about gathering. Legal name, birth date, social security numbers if you have one, immigration status paperwork if you have that, income information, any current health insurance information, and members of your household, even if they are not applying. This way you can really look at the best health plans and the best options for your particular situation. You want to move to the next slide. We have a couple of different scenarios. So who is eligible for Apple Health Expansion? So in this example, Giovanni is 52. He does not have an immigration status that qualifies him for a federally funded Apple Health program. He makes $1,500 a month. And just based on that information, Giovanni would be potentially eligible for Apple Health Expansion. So his next step would be to complete an application at Washington Healthplanfinder. We move to the next scenario. We have Karina, who's 35. She's lawfully present and has not met the 5-year bar. She has 2 people in her household. She makes $2,700 a month. And while she may not be eligible for Apple Health Expansion, she may be eligible for a QHP plan or qualified health plan with tax credit. And so we would encourage Karina in this example to apply at Washington Healthplanfinder. We go to the next slide. Ramon and Jasmine are 26. Neither of them have an immigration status. They have 4 people in their household. They make $2,800 a month. They may be eligible for Apple Health Expansion, the adults, Ramon and Jasmine, while the children could be eligible for Apple Health for Kids. To find that information out, we would encourage Ramon and Jasmine to complete an application at Washington Healthplanfinder. Then we have Gloria, who's 72. She does not have an immigration status. There are 2 people in her household. And she makes $1,500 a month. She may be eligible for Apple Health Expansion based on those criteria. So in her case, we would encourage her to go to washingtonconnections.org. If you move to the next slide, perfect. We go one more back. There we go. So you'll note there that we tried to provide an idea of how to tell who might be eligible for Apple Health Expansion and who wouldn't. The best way to know for sure is to put your application in. And the vast majority of people could go to almost everyone could go to Washington Healthplanfinder and fill out an application. They can enroll in coverage there if the adults are ages 19 to 64. Kids, parents, caretakers with children, pregnant individuals would all kind of be able to enroll at Washington Healthplanfinder. The other option, and Washington Healthplanfinder would move someone over, is to go to Washington Connections. So if we move to the next slide, this enrollment pathway is open to individuals who are over the age of 65. You can apply online at Washington Connection, through the phone number here, or a paper application in person at a DSHS community service office, or in a home and community services office. You want to move to the next slide. Talk a little bit about other transitions. So as we think about Apple Health expansion starting on July 1st, there are a couple of populations that we know are eligible for Apple Health expansion. They may already be enrolled in an Apple Health program today that I didn't mention would stay, right? So we talked a little bit about emergency services, or AEM, at the beginning of the slide show. Those individuals are currently receiving services for emergency reasons, for cancer, for dialysis, or for a transplant. If they are enrolled in emergency services as of June 30th, they'll transition to Apple Health expansion on July 1st. That'll be a transition. They'll receive information about that, and there will be some outreach done. If an individual has already purchased a qualified health plan and they are deemed eligible for Apple Health expansion, so they're 19 or older and 138% of the federal poverty level, we will transition them over to the Apple Health expansion program on July 1st. HCA and Health Benefit Exchange will work together to do outreach to those individuals. And we'll try to mirror the process that we already have in place today for other individuals who may be enrolled in a QHP and then become eligible for one of the many Apple Health programs that we have today. We can move to the next slide. Talk a little bit about privacy. Again, the beginning of the slide deck, we talked about affordability. We talked about trusting government websites, and we really want to talk a little bit, right, about what privacy looks like. So as we move through the next few slides, we could move to the next slide there. HCA is required under law and HIPAA to maintain the privacy of its clients' information. We take that very seriously, as do our partners at Health Benefit Exchange and the Department of Social and Health Services, which houses our Washington Connections database. There are a limited number of reasons why HCA may use and disclose information, and this includes determining eligibility for Apple Health coverage. A full list of those disclosures are in our privacy policies, which are posted on our website. Those links will be available to you at the end of this slide deck. We want to move forward to the next slide. The privacy policies listed below are provided to clients on a yearly basis. And I would just note here, we do not share information with any immigration agencies. So I think that is really important to note for this group. If you want to move to the next slide, public charge. So wanted to just address public charge. U.S. citizenship and immigration services processes immigration and naturalization applications and receipt of Medicaid benefits when an individual applies for legal permanent residence in the U.S. So only benefit considered for the public charge test is long-term care, such as a nursing facility. So just wanted to address that there. You want to move forward to the next slide. We have many resources around public charge and more information. So I would encourage you to take a look at those links. You want to move to the next slide. And confidentiality and safety. And I think I've already noted that HCA and DSHS HBE, we're all committed to client privacy and that we do not share information about clients with anyone unless authorized by the client themselves or notified. You want to move to the next slide. Wanted to touch here on language access and interpreter services. So HCA provides language access services today Those include translation services in 15 languages and then additional languages upon request. We have over-the-phone interpreters or OPI interpreters available in 217 languages, video remote interpreting in 22, and then we have sign language interpreters in a variety of different languages as well. You can learn more about our language access program online as well. So I want to move to the next slide. Outreach and community engagement. So Healthcare Authority has partnered with our state agencies, our state sister agencies rather, Health Benefit Exchange and the DSHS. And we're developing outreach materials right now that can be translated and added to an outreach toolkit. And we are looking for feedback on what to include. So you'll see through our Gov delivery or automated email system calls for requests for feedback on outreach and other communication materials produced here by the Healthcare Authority team. We also have a community engagement advisory committee. This is made up of community-based organizations, those with lived experience, and community and legal advocates. And that is another area that we ask for both feedback and input on our outreach processes. We want to move to the next slide. I think now I will pass the baton over to Joan Altman from the Health Benefit Exchange and Jenny Arredondo.
Thanks, Becky. Joan here. Not sure if you can see me. I'm not enabled, so we'll spare you all my faces unless someone wants to see it.
I think I just fixed it, Joan. Thanks for your patience. You may not be happy with me for fixing it.
Okay. Well, good afternoon, everybody. Thanks to the, I think looks like nearly 500 people who've joined. So it's quite an impressive showing. My name's Joan Altman. I use she, her pronouns. I am the Director of Government Affairs and Strategic Partnerships at the Exchange in my day job. And in my side job, I've been pretty engaged in the immigrant health expansion. We had to apply for a federal waiver to be able to offer the expansion, which is primarily where I was engaged in negotiating that with the federal government. And Jenny, I know you're on too. Do you want to introduce yourself before we dive into content here?
Sure thing. Good afternoon, everyone. I am Jenny or Genevieve Arredondo. I use she, her pronouns, and I am the interim Associate Director of Outreach here at the Health Benefit Exchange.
Awesome. Thanks, Jenny.
Mm-hmm.
Okay, well, first, thanks to everyone. There are hundreds of you on the call, so I know there are probably hundreds of people who are involved in our November 1st launch for the Qualified Health Plan and Qualified Dental Plan expansion. So thank you. Since November 1, we've had nearly 25,000 people come in and apply for coverage through Healthplanfinder, which is phenomenal. In just a matter of weeks, we've seen, a good number of the people that we anticipated who were uninsured and undocumented in the state come in and see what they may qualify for, which has been really phenomenal. The next slide shows you sort of as a general reminder what people who are undocumented who are coming to Washington Healthplanfinder can experience and have the option to purchase now. So if you come to Washington Healthplanfinder, obviously the Medicaid side expansion hasn't started yet. You set up an account through Washington Healthplanfinder. As part of that process, due to federal kind of requirements, you have to prove your identity as an anti-fraud prevention effort. There's some more information further on about that and in a prior webinar about how to manage that process. So you come to Healthplanfinder, you set up an account, you prove your identity, you enter a bunch of information for those of you who experienced it about who you are and your finances that enables us to figure out what program you might be eligible for. You submit your application. If you are eligible for one of the existing programs that Becky spoke about, you are sort of automatically put in those programs. If you are not eligible for any of those programs, then you have the option to purchase qualified health plan and qualified dental plan coverage. if you pick a certain type of plan, which has an icon next to it called the Cascade Care Plan, then there's extra financial assistance available to you in the form of a state premium subsidy. So under federal law, we can't offer people who are undocumented federal tax credits, but we can offer people state subsidies, which launched in 2023. So you come in, you pick a plan, you get the state subsidy, and that helps lower your premium, understanding that that's still at a price point that isn't affordable to many low-income people who are seeking coverage. The next slide speaks a bit to how we're able to offer this expansion. I'll just briefly touch on, I'm not sure, feel free to just click through. I'm sorry, I don't know why we got potentially fancy with animation on this slide, and or if it's there's no text, this will just be your moment of zen for the afternoon. Okay, great. So more information than you could possibly want about our federal waiver is available online. Essentially, there's language in the Affordable Care Act that says people who are undocumented can't use a marketplace or an exchange to get coverage. There's a federal waiver that waived that restriction. So that is how we are the first and only state-based marketplace in the country who we have the same enrollment and eligibility pathway for everyone, regardless of your immigration status. So you don't have to go through a separate doorway or use a separate process. Everyone in Washington who wants health coverage can come to Washington Healthplanfinder and see what they're eligible for. Shameless plug and promotion, since y'all are a captive audience, as part of our federal reporting requirements, we do a public forum within the first year or so of launching, 6 months of launching the waiver. They want to hear from people in Washington whether the waiver has been helpful for people to access coverage, whether it's something important, whether it's something that the federal government should continue to consider and support. So we will be sharing more information about that as we get closer toward the spring. Okay, on to the next. Here are big launch top lines that are probably of most interest to people on the call. Again, nearly 25,000 people have applied for coverage since November 1st. About 2,200 have signed up. So obviously there's a big disparity there between people who've been able to come in, set up an account. As part of setting up the account, I will flag here, looking ahead to July 1st, that coming into Healthplanfinder, setting up an account and submitting an application is the way that we are able to, looking ahead to July 1st in partnership with Healthcare Authority, send updates and information about the new program and availability and how to access it moving forward. So we've been highly encouraging people who are interested in the expansion. Maybe you're not in a position to be able to afford qualified health plan or qualified dental coverage now, to come in, go through the identity proofing process, establish in Healthplanfinder that you want to apply for all available Apple Health programs. There's a question in Healthplanfinder that says, do you want to be screened for Apple Health and financial assistance? It's defaulted to yes. Everyone needs to click yes. Also, as part of setting up your account, you identify whether you want to receive notifications electronically or by paper. Receiving notifications electronically allows you to get it in a little bit of a more immediate way than if you elect to receive things by paper. Majority of our applicants now opt to receive things electronically. So these are things people can do now as they're getting ready for the July 1st expansion, so that one, we know who in the system looks eligible for the new expansion, and two, we know how you want to be communicated with, what your language preference is, and you're sort of ready to go as we move forward into this second launch for Apple Health. So you'll see down here, we have a new enrollment report that's out that provides a little bit of a look of who our new customers are. We have an additional information about our new population that will be coming shortly, that looks at demographics, and we'll make sure that gets circulated to interested people when it's available. Okay, next slide, please. I do want to acknowledge and thank, new for us this year, we have an amazing network of navigators and brokers and tribal assisters who help support this work. We were able to provide a little bit of extra funding to those groups to do some additional and enhanced outreach work for us. We also, for the first time this year, were able to give little stipends to 9 community-based organizations to help us do the work. So some good lessons learned there. The exchange is we are not HCA. We are a small but mighty shop of, Jenny's team is a few people and our contracts team is 2 people, so that they were able to sort of quickly pull together a way to move $100,000 out the door to some folks who could help us refer people to navigators and be trusted messengers in community. We really appreciated that. We know there's sort of widespread interest in continuing to explore that model, and we look forward to working in partnership with the Healthcare Authority on how you could achieve that in a larger scale way. We are the small shop here. Healthcare Authority obviously has a lot of experience pushing bigger grants and bigger money out the door. So something that's on the radar for us and continuing to engage in conversation on. The next slide, you can just skip through. Those are some of our remaining partners there. Sort of the final substantive slide here, the thing that is my main key takeaway, if you take away nothing else from the qualified health plan and dental plan part of this presentation, is that every year we have an open enrollment period that goes from November 1st to January 15th. And that is where we saw the 25,000 people come in and apply for coverage. That can still happen. You can still do that today if you are still working with people who need health coverage or who are interested in the upcoming expansion. Come into Healthplanfinder, set up an account, enter the information you need, hit submit, and get a result. That is, identify how you want us to contact you. If you have any challenges getting through our system or setting up your account, call us, work with a navigator, work with a broker, call our call center. We can help get as many people set up now before July 1st as possible. That will help as we move closer to the sort of transition date with the new program. A few words of caution here. To enroll in qualified health plan coverage outside of open enrollment, you have to have a special enrollment event. So to come in and set up an account and submit an application, you can do that at any time. We're encouraging everybody to do that. If you are working with folks, or you are someone who's thinking, oh, maybe I'll just sign up closer to the July 1 date, there are specific circumstances. We cannot just open up the system all the time for everyone under federal law and under how health insurance works. The idea is that you buy health insurance and then everybody does that instead of just waiting till they get sick and then signing up, and that's how we can keep it sort of affordable. And by sort of, I mean not very, but more affordable than it would be otherwise. So, there are certain circumstances that allow you to sign up after the open enrollment period that we just finished. One of them is if you were under 250% of the federal poverty level. So, and you are not already enrolled in a plan where you are getting state subsidies. So if you are someone who is income eligible for the new Medicaid expansion, you are obviously under 250% of the federal poverty level. If you are not already enrolled in a plan and getting a state subsidy, that is a way that you are able to come in and sign up for coverage still. So if you're working with someone who needs coverage, you should come in. You may be eligible for a state program already. And if not, then you have an option to buy a qualified health plan. If $200 a month is too expensive, which we know it is for many people, then you're sort of set up in the system and sort of able to, without having to re-identity proof yourself and reestablish an account and re-enter all your information. We need to be current. So if something changes for you, come in and update your account. But otherwise, you're sort of ready to go for July 1st. So I'll pause there. The remainder of the slides, Becky, we can sort of scroll through them. And Jenny, if there's anything important to add here, scrolling through, we developed some new resources and some new social media materials and some new translated materials in support of this effort that are available. They're not specific to one program. They say, just come to Healthplanfinder. Here's where you can get help. So we're continuing to use those, and they're still going to be available as part of supporting the July 1 launch. So again, for those who haven't seen our partner toolkit and our flyers and videos and brochures, sort of highly encourage you to understand and take a look at what's there, developed in partnership, again, with the community and with the VITA agency. And again, just lots of partners informing a whole new suite of materials for us, which we really appreciate. Again, I think 20+ languages for most of the materials, and getting some good seeing some good information in Healthplanfinder about people who've been able to access our site with numerous types of language assistance requests. So again, the rest of it's resources. We'll sort of pause, and Becky, I know we sort of have some questions that have been rolling in, so we'll look to you to see how to best support there.
Yeah, I think with lots of great questions, and thanks, Joan, always such great information. And I do encourage folks to go through these slides when they're posted. I think there's lots of information in here that can be helpful to the communities that you're serving, or to yourselves, or to clients, depending on who you are and what role you play in our system today. So I think we've got quite a few questions in the chat, and I think we are encouraging folks to go ahead and set up an account in Healthplanfinder prior to July 1st. But what I will note is that we have not determined a date where we'll start to take Apple Health expansion specific applications. Once that information is available, we'll push that out on our website and our automated email system, GovDelivery. I'm sure we'll have another webinar and we will talk about that. We'll get the word out there kind of far and wide. But at this point, we don't have an exact date on when those applications will be available. So I do see there's quite a few questions that are related to that. So just wanted to make sure that was clear. We also just wanted to provide more information about what you would need to have with you if you decide to fill out and create an account with Healthplanfinder, or as you're preparing for the actual application date for Apple Health expansion. So just wanting to be transparent and supportive in that space as we work through. Sarah, I know there's many more questions, but just wanted to kind of hit those two pieces. Oh, and the other one is this. There are several questions asking how many individuals will we have room for in Apple Health expansion. We don't have an answer to that question today. Again, as soon as we have that, we will be sharing that out far and wide. You'll see us come out with that information as soon as we have it available. This program is complex and challenging, but really good work, and we are doing our best to get the right estimates for the number of individuals and lives that we can cover in Apple Health expansion. So more to come on those pieces, and I think there's lots of questions around that. So, but I'll stop there. I know we have some Q&A that we would like to get through.
All right. So our first question. Will this program include individuals with a substance use disorder, especially medicated assistance treatment like methadone?
Yes. So and I assume that you're talking about Apple Health expansion. And yes, Apple Health expansion has both behavioral health. So it includes substance use disorder treatment in that suite of services.
For the interpretation services that will be available for clients, will Guatemalan dialects be available? And an example is mom.
Yeah, I appreciate that question. And I appreciate hearing the needs of the communities that you are in and or serving or a part of. And so we appreciate you highlighting those for us. We have a list of languages that I think are less common in our Apple Health programs today that we're looking at both internally and sharing with our managed care organizations. And so I know MEM is on that list. I'm not sure about the other two dialects, but I think we'll make sure that we add them. And when I say adding them to the list, what I mean is that we're looking to ensure that we're ready to provide support services in those language and dialects. And I would ask, I think it was Bellamy, if you would like, or no, I'm sorry, it was Tracy, my apologies. Tracy, if you could put in there, I'm not sure if all three of those dialects are suitable for written translation, or one or more of them are better in oral translation form. We really appreciate knowing that as well. So thank you for highlighting that.
All right, next up. Does the different pharmacy coverage mean that there may be co-pays or just a different list for generic and name brand that are covered?
Just a different list. There aren't any co-pays associated with the Apple Health expansion program, so there's no out-of-pocket expense associated with Apple Health expansion.
All right. If there are no slots in Apple Health for folks that qualify for AEM, would they remain in that program until there was space available?
So eligibility for emergency medical services is time limited. So that program is a unique program. It is set up to provide services to folks who are receiving emergency services or cancer treatment or dialysis or post transplant care. And so it is limited in duration to those time, or to the, to however long it takes for those services to be rendered and delivered. And so an individual who is in AEM, if they're at the end of that period for AEM, their eligibility is ending, we would redetermine eligibility and try to find the next best program for them. That could be Apple Health Expansion. If Apple Health Expansion is full, then that individual would not have a program immediately available to them in the Apple Health suite of programs. They would have a qualified health plan option available to them. And Jenny, Joan, hop in here if I misspeak.
Okay. Is there an enrollment period for undocumented folks? Can they apply at any time?
So I think that this question it could be interpreted to be for both QHP and Apple Health Expansion. I see Joan popping on. So I'm just going to say, again, for Apple Health Expansion, we don't have technically what you would refer to as an open enrollment program, or open enrollment time period, rather. I'll let Joan talk about creating an account on Healthplanfinder. We will have an application available for Apple Health Expansion. And again, we'll advertise that date far and wide and as broadly as possible. Joan, you want to talk about the rest there?
Yeah, so and Becky, keep me honest here. I want to make sure I'm not in the nuanced way I'm saying it, leading us down any pathways that we shouldn't be going down. But, if you are someone in the state of Washington who needs health insurance coverage, regardless of your immigration status, it doesn't matter, at all who you are. You come to Washington Healthplanfinder, you set up an account, you enter your information, and you see what health programs you're eligible for. That's the beauty of having one integrated, comprehensive system in our state, is that we screen you for all available Apple Health programs, and then we screen you for all available federal and state financial assistance. And then we say, hey, if you're eligible at the end of all that for a qualified health plan or a qualified dental plan, then go ahead and select a plan, pay for that plan, and you'll have coverage that way. So, for people who come through that whole process and are eligible for a qualified health plan and a qualified dental plan, if you come in during the open enrollment window, you can sign up, you can switch. You don't really, that is the concentrated period of time where people shop for and switch their insurance coverage. If you are outside of that window, and you have had a change to your household size, or you've newly moved to Washington, or you've had a baby, so that's going to change sort of how your income level is spread across your household. As changes occur in your household and in your life over the course of the year, that may, where different health coverage may be available to you, and or different levels of financial assistance may be available to you. We encourage everyone to come back to Healthplanfinder, update your account, and to the extent that you are newly coming to Healthplanfinder or updating account and that you already have in Healthplanfinder, we recalculate your eligibility for federal and state assistance. And if you qualify for something new or something different, then you have an opportunity to come in and switch plans and or sign up for coverage. So the system does it for us. Like, you can go online and see a whole bunch of information about special enrollment periods and what triggers what. The good news is that Healthplanfinder was built in a way that it will screen that for you. So if you have a change in circumstance and you think, oh, does this newly qualify me for health insurance, you can come in and the system will figure that out for you.
All right, we have time for one more question. When can clients start applying for this Medicaid expansion with Washington Healthplanfinder or Washington Connection?
So I think as Joan just noted, they can go in, they can to Washington Healthplanfinder and create an account at any time. It'll give them a real-time eligibility result. And it won't say Apple Health expansion yet, because again, the Apple Health expansion application is not available. And once it is, we will share that out. And that's when folks will be able to enroll into Apple Health expansion. And so more to come on that piece. And I think if you go to Washington Healthplanfinder, Joan, and you're 65 plus and you need to be moved over to Washington Connections, there's a transition for that, right?
Yeah.
Yeah. So you could go in that way. I think it's helpful if you want to walk through and create the account. I think that's always a good first step for folks. And I think that's why we keep saying it over and over again. But yeah.
All right, that's the Q&A. Riley, will you move to the next slide, please?
And Sarah, while you all are doing that, I'll just add one thing. I'm seeing some questions in the chat about, sort of transitioning people to and between Apple Health coverage and qualified health plan coverage. And I will just say, this is something that happens, there are 500,000 people who churn between Apple Health and qualified health plan programs throughout the year. And there's even more who've been churning recently. So moving people to and from these different coverage programs is pretty familiar to people at the exchange and people who are at Healthcare Authority. The reason that we maximize people's federal assistance and state assistance is because affordability is such a primary barrier. If someone is in a qualified health plan and they newly qualify for Apple Health, they report a change in their circumstance, or they come back into the system and qualify for Apple Health. Folks are auto-enrolled today. People are auto-enrolled into Apple Health. For people who, like their qualified health plan, want to stay in their qualified health plan, there's a process for someone to do that. The huge caveat there is that if you are eligible for Medicaid, any of that suite of, sort of generally speaking, the Apple Health programs, it disqualifies you from federal and state subsidies on the exchange. So if you want to stay in the exchange, you just end up paying full cost for coverage, as opposed to being in an Apple Health-based program where you are paying nothing or very limited cost sharing amounts. So I'm seeing there's some concern about moving people over. There is always an option for people to stay put, just it's typically at a price tag level that folks can't maintain.
Yeah, thank you, Joan. I did notice that too. And I think it's a really important piece. I think we've been dedicated to between the Health Benefit Exchange and Healthcare Authority to really make sure that we're clear in those transitions. We have some letters that we normally produce around that work. And I think wanting to get some feedback about how we can ensure a good transition for folks. We want to make sure they all understand what's happening. We realize how important that is. And healthcare is complicated, right? But we want to make sure that we give them the lowest cost coverage and the best coverage that we can for them wherever possible. And that is it's sort of been the goal of Apple Health in general, regardless of your immigration status. And that's why Joan noted we have a lot of churn between the two agencies. A couple of things in the chat here, and I think Sarah, you're going to go over that. Is that right? Or am I?
Yes.
Okay.
Yeah. So we have included a survey link. This will be open for 2 weeks. I have included it in the chat, and I do believe we have this on a slide as well that can be put up. There you go. And then if you have not signed up already for our Gov delivery updates, I've added that link as well. So you will be notified of some of the things that we've talked about today when there are updates.
I'll note the Menti survey we had a similar one with our first Apple Health expansion webinar. This one is similar but has some new questions. We do really evaluate the answers to those questions. So please, if you could take a few minutes, and we appreciate everybody attending today. We use those survey questions to help inform the next webinar and other outreach materials. And so we do look forward to hearing from you. I think also I'll note we didn't get to all the questions, so appreciate your patience with that. We will publish a new FAQ for this webinar as quickly as possible. And we've got a couple of different ways, right, to submit more questions here. We've got a dedicated inbox for Apple Health expansion. And then I know, Joan, you and your team have one for coverage on the exchange as well. I think with that, we're 1 minute over. Again, I can't thank huge attendance today. Thank you so much. We really do appreciate you all attending and your interest in this work and your work in the community. For those of you who are out in the community supporting this population and others, we really do appreciate your service. Thanks all. Joan, anything you'd like to input there? You're on mute.
Nothing else for me. Appreciate y'all. Thanks for everything you do.
Thanks, everyone.